We ask, what's going on underneath this? Because what looks like anxiety might be trauma. What looks like ADHD might be burnout. What looks like defiance might be someone just trying to survive. Psychiatry isn't about fixing people. It's about helping them understand their mind so they can work through it, not against it. Hey everyone, welcome back to Shariq Refai. I'm Shariq Refai, board-certified psychiatrist and the founder of ShrinkMD. This is episode 6, the final episode of the season. And today, we're going to talk about something a little bit different. Not a diagnosis, not a single symptom or condition, but the field itself, psychiatry. What it gets right, what it still gets wrong, and why it's okay, maybe even necessary, to ask hard questions about it. If you've ever thought, do I really need a psychiatrist? Aren't meds overprescribed? Is this just about labels? You're not alone. And let's talk about it. Psychiatry is medicine, but for the mind. We go to medical school, we study anatomy, physiology, pharmacology, just like every other physician. But then we take a different path. Instead of treating organs you can scan or cut into, we treat emotions, thoughts, behaviors, things that are real, but they're not always visible. Psychiatrists diagnose and prescribe, yes, but at our best, we listen. Not just for symptoms, but for context. We ask, what's going on underneath this? Because what looks like anxiety might be trauma. What looks like ADHD might be burnout. What looks like defiance might be someone just trying to survive. Psychiatry isn't about fixing people. It's about helping them understand their mind so they can work through it, not against it. That's the goal. But we don't always get there. Let's talk about the elephant in the room. I've had people say, psychiatrists just hand out pills. They don't really listen. They label you and send you on your way. And you know what? Sometimes that might be true. Sometimes people are seen for 10 minutes, given a prescription, and left wondering what just happened. I've seen patients after those kind of experiences. I've heard the frustration. I've felt it too. But that doesn't mean psychiatry itself is broken. It means we have to practice it better. Here's how I look at meds. They're not magic. They're not for everyone, but they can be powerful tools when used thoughtfully, in partnership with the patient, not to them. Sometimes a medication lifts the fog just enough for someone to actually start healing. Sometimes it causes side effects that aren't worth it, and then we adjust. Either way, it's a process, not a one-size-fits-all solution. Let me run through a few of the things I hear all the time. Will this med change who I am? No. And if it does, it's the wrong one. Good treatment doesn't erase your personality. It should bring you back. And then, will I be on this forever? Not necessarily. Some people need long-term support. Others, it depends on your brain, your body, your life. And then, can I try therapy first? Absolutely. Therapy is often the first and sometimes the only thing people need. Other times, therapy and medication works better together. And then, but I'm not that bad. Should I even see a psychiatrist? You don't have to be falling apart to deserve help. Psychiatry isn't just for crises. It's for clarity. And then, I'm scared of being diagnosed. Totally understandable. But a diagnosis isn't a life sentence. It's a guide. It gives us language and options. It doesn't define who you are. I want to share 2 patient stories. They're the kinds of moments that keep me grounded in this work. First, there's Marcus, mid-40s, recently divorced, working in finance, high achiever. He came in saying, I'm thinking I'm just bad at relationships. But the more we talked, the more it became clear. Marcus wasn't just struggling with a breakup. He was cycling through intense highs and deep lows for years. In one phase, he'd start new projects at 2 a.m., run marathons, feel invincible. Then out of nowhere, he'd crash, stay in bed for days, feel worthless, cut off everyone. He had no idea this was bipolar disorder. He just thought he was too intense or too emotional. We started treatment. Slowly, carefully, no rush. And one day Marcus said to me, "This is the first time like I'm not at war with my own brain." Then there's Melissa, late 20s, mother of two. She came in during what she called a rough patch. Turns out she'd been experiencing extreme mood changes the week before her period. Every month, she'd cry uncontrollably, get irritable at everyone, feel disconnected from her kids. Then like clockwork, it would lift. She thought it was just part of being a mom, or maybe just stress. But it was more than that. It was premenstrual dysphoric disorder, PMDD. And while it's complex and hard to treat, it helped her to finally name it. We talked about options, support, symptom tracking, lifestyle changes, a different way of seeing herself, not as crazy, but as someone with a pattern with understanding. She told me just having a name for it made me feel less alone. Neither Marcus nor Melissa walked out of my office fixed, but they walked out with something better, clarity. And that's what psychiatry can offer when it works well. Let's not pretend the system is perfect. Too often, appointments are rushed, nuance is lost, people feel like numbers, and in some cases, psychiatry has caused harm by overdiagnosing, overprescribing, or ignoring trauma. But the answer isn't to abandon it. It's to do it better, to listen more, to ask better questions, to remember that every diagnosis is a human story, not just a label, because when it works, it really works. It's life-changing. Here's the part that you won't always see on Instagram. Healing isn't glamorous. It's sleeping through the night for the first time in years, texting a friend back when you normally would have ghosted them, catching yourself mid-spiral and saying, "Wait, I know what this is." Realizing you don't hate yourself today. And that counts for something. It's small, it's cumulative, it's real, it's different for everyone. So why do I stay in the field? Because I believe in second chances. I believe people aren't broke. They're overwhelmed, misdiagnosed, burned out, misunderstood, or just tired of pretending. And I wanted to build something that made it easier to help without the hoops. That's what ShrinkMD is about. No sales pitch, no hard push, just a place where care feels human, where the conversation starts with, "How are you really?" So if you've related to anything in this series, if it's made you feel seen or just less alone, thank you. That's why we made this. This is the last episode of season 1 of Shrink Wrapped. We've talked about depression that hides in plain sight, anxiety that whispers, not screams, women's mental health, athletes, bipolar disorder, and now psychiatry itself. And through all of it, one thing's been clear. You're not alone. You never were. You don't need to have all the answers. You just need someone willing to sit with you and ask you the right questions. So thank you for listening, for sharing, for being part of this. We'll be back for more, and until then, take care of your mind. It matters more than you think. Let's keep the conversation going. Thank you.